Hello everyone, welcome to Dr. Shravani's Med Concepts. In this session, I am going to teach the basic concepts of adenomas of breast as per WHO classification in a very interesting way by case-based approach, which is very useful to pathology postgraduates and NEET PG super specialty aspirants. Coming to the topic, as per WHO classification 2019, tubular adenoma, lactating adenoma and ductal adenoma are categorized under adenomas of breast. A nipple adenoma is placed under the category of nipple lesions. So we'll learn about adenomas of breast in today's session as case-based approach. Coming to the first case, a 45-year-old woman presents with unilateral nipple discharge, scaly ulcerated nipple and a small palpable nodule beneath the nipple. Biopsy findings are displayed in the image. Which of the following is the most likely diagnosis? So in this case, based on the clinical findings, 45-year-old woman, that is elderly women with unilateral nipple discharge, means only one breast is involved, scaly ulcerated nipple. Okay, so in this diagnosis, the conditions which presents with the scaly ulcerated nipple are nipple adenoma, Syringomatous adenoma, Paget's disease of the nipple. All these presents as scaly ulcerated nipple. So all this becomes differential diagnosis. As it is elderly women with unilateral nipple discharge, invasive ductal carcinoma also becomes a differential diagnosis. And all of them presents as a small palpable nodule beneath the nipple. So how to exclude this based on the biopsy? So this is the biopsy image. I will explain you in detail step by step. So this is the image. So in this image you can see there is well circumscribed lesion in the dermis. So this is a well circumscribed lesion. Okay, but it is unencapsulated. Okay, so there is well circumscribed lesion which is unencapsulated, and this lesion is consisting of papillary formations, that is glands are arranged in papillae and glandular architecture. So here you can see all these are the papillae and glands. And what are these glands lined by? They are lined by two layers of cells. Okay, inner epithelial cells and outer myoepithelial cells. So this is the outer myoepithelial cell lining. This myoepithelial rimming is a classical feature of all benign lesions of breast. And in the epidermis, you are able to see epidermal ulceration, as you can see here. So this is epidermal ulceration and pseudoepitheliomatous hyperplasia. There is pseudoepitheliomatous hyperplasia in the epidermis. So with all these features, final diagnosis is nipple adenoma. Coming to other differential diagnosis, that is Syringomatous adenoma of the nipple. In this condition, as you can see here, in the epidermis, there is no changes in the epidermis. Okay, there is no epidermal ulceration and pseudoepitheliomatous hyperplasia in the epidermis. That is one of the important point to differentiate from nipple adenoma. And in the dermis, similar to the nipple adenoma, you are able to see the glands and tubules which are lined by double layered epithelium, and myoepithelial rimming is also there. Here the glands are arranged in the form of comma, teardrop or branching shapes. Other condition, that is Paget's disease of nipple. Similar to the nipple adenoma, Paget's disease of nipple also presents as a crust of the nipple and nipple discharge. That's why Paget's disease of the nipple, first it should be your first differential diagnosis. So in Paget's of the nipple, that is Paget's disease of nipple, what you will see is there are clear cells, okay, at the dermoepidermal junction. So you will see clear cells at the dermoepidermal junction. These are known as Paget cell. In this image you can see large round to oval cells. Okay, so these cells are large round to oval cells which are filled with vacuolated clear pale cytoplasm. So here you can see the cells are showing abundant pale clear cytoplasm, and what happens in the nuclei, they are pleomorphic and showing prominent eosinophilic nucleoli. All these features put together we call them as Paget cells, and you see that such type of cells in the dermoepidermal junction initially, later on extending into the epidermis. And these Paget disease, this Paget cells, all these cells are present in the epidermis, but in the dermis, usually these Paget disease of nipple is associated with underlying ductal carcinoma in situ or invasive carcinoma of breast. So this is how you should exclude Paget's disease of nipple. So this is the table showing all the 4 differential diagnoses. Paget's disease, you will see Paget cells in the epidermis, myoepithelial cell remaining as absent, and clinical clues is eczematous nipple. Okay, invasive ductal carcinoma, you will see irregular infiltrative glands and desmoplastic stroma with nuclear atypia. In this also myoepithelial cell remaining will be absent, and it presents as a mass lesion which may involve the nipple. And coming to our diagnosis, that is nipple adenoma, there is papillary or glandular proliferation, teardrop shaped ducts, and epidermis is showing changes like epidermal ulceration and pseudoepitheliomatous hyperplasia. Myoepithelial cells are present, and it presents as nipple discharge, erosion, and it usually has benign behavior. Coming to Syringomatous adenoma, it shows infiltrative small ducts in the fibrotic stroma. Often deep dermal involvement also can be seen, and myoepithelial cell rimming is present. It presents as firm subareolar nodule, and it can be locally aggressive, but it is a benign condition. Coming to case 2, a 28-year-old primiparous woman presents with a rapidly enlarging painless breast lump in the 3rd trimester of pregnancy. Ultrasound shows a well-defined lobulated mass. Okay, so you can see details in the clinical details. The clue given is it is 28-year-old primiparous woman. Okay, so the age is 28 year and primiparous woman, and she is presenting with a mass in the 3rd trimester of pregnancy. Okay, 3rd trimester of pregnancy, and ultrasound shows a defined lobulated mass. Okay, so it in the clinical condition itself there is a clue that it is associated with some lactation. Okay, so it is a case of lactational adenoma. So this is the low par view, this is the scanner view, this is the low par view, and this is the high par view. In low par you are able to see all these are the hyperplastic lobules. Each one is a lobule. So you are able to see well circumscribed lesion which is unencapsulated, and it consists of closely packed hyperplastic lobules. And in the low par view, these lobules are lined by cuboidal epithelial cells which can be columnar also, showing hobnail pattern. Okay, so this is a hobnail pattern you are able to see here. This in the next picture you'll be seeing it clearly. So in this hyper view you are able to see lobules which are lined by epithelial cells and filled with secretions. What type of cells are these epithelial cells? It can be cuboidal, which shows vacuolated cytoplasm, and it can be columnar, and you will see some specialized cells known as hobnail cells. In this hobnail cells, nucleus will be protruding into the glans lumen. So these are the hobnail cells. Okay, if you observe here, it is looking like a hobnail. Okay, so in this towards the lumen, the nucleus appears as if it is protruding into the lumen. Okay, so this is known as hobnail. So here you are able to see such type of hobnail cell, and this is another hobnail cell. Okay, so all these are hobnail cells, which is a characteristic feature of lactating adenoma. So the final diagnosis will be lactating adenoma. These are the differences between lactating adenoma and fibroadenoma. Lactating adenoma usually presents in lactating mother 20 to 35 years with soft mobile lump, painless during pregnancy and lactation. Fibroadenoma is firm, mobile, painless mass which occurs in young women between 15 to 35 years. In histology, in case of lactating adenoma, proliferative lobules are seen with secretory change, and hobnail nuclei is the characteristic feature. In fibroadenoma, biphasic pattern. Till now, all adenomas like lactating adenoma, tubular adenoma, ductal adenoma, all these show only epithelial proliferation, whereas fibroadenoma, it shows biphasic proliferation, that is both epithelium as well as stroma is proliferated. Myoepithelial cell rimming will be present both in lactating as well as fibroadenoma. Secretions will be present in lactating adenoma, and stromal component is very minimal in lactating adenoma, whereas it is prominent in fibroadenoma. This is case 3. A 23-year-old woman presents with a firm, mobile, painless lump. Okay, 23 years, young woman, firm, mobile, painless, giving a clue that it is a benign condition. On examination, the lesion is small, well circumscribed, and not attached to the underlying tissue. So, based on the clinical picture, you will get that it is a benign lesion. Okay, so here you will see a scanner view, well-formed tubules lined by epithelial cells, double layered epithelial cells as shown in the low part. So what will be your differential diagnosis? It can be fibroadenoma, it can be tubular adenoma, it can be Phyllodes tumor, and DCS also can be one of the DD. So here you are able to see the lesion which is well circumscribed, and it is consisting of closely packed tubular structures. So all these are the tubular structures, and these tubules are lined by double layered of epithelial cells, inner epithelial and outer myoepithelial cells. As I told you already, presence of myoepithelial cell is the classical feature of any benign lesion, and in between the tubules there is a sparse stroma. Okay, this differentiates it from fibroadenoma. In fibroadenoma you will see plenty of cellular stroma, but in case of tubular adenoma we will see only sparse stroma. And tubular carcinoma is another condition which is invasive carcinoma, which will be very similar to the tubular adenoma, but in that you will not have any myoepithelial cell layer lining, and nuclei will be showing atypical features. So this is the differentiating features between tubular adenoma, ductal adenoma, and tubular carcinoma. So by definition, tubular adenoma is a rare benign tumor with compact proliferation of small tubules and minimal stroma. Ductal adenoma is a benign intraductal proliferation, sometimes considered as a sclerotic evolution of intraductal papilloma. Tubular carcinoma is a malignant invasive carcinoma with well-formed tubular structures and low-grade nuclear features. Coming to age group involved, young women of reproductive age group are involved in tubular adenoma, whereas in ductal adenoma it occurs in older women. Tubular carcinoma occurs in middle-aged women. In histology, closely packed small tubules with minimal connective tissue and epithelial predominance is a classical feature of tubular adenoma, whereas in ductal adenoma, similar findings with less stroma and intraductal growth is the classical feature of ductal adenoma. In tubular carcinoma, malignant tubular structures with invasive pattern and loss of myoepithelial layer. So here loss of myoepithelial layer in tubular carcinoma is the classical feature. Coming to the malignant potential, tubular carcinoma, it has malignant potential, it is malignant, and tubular adenoma and ductal adenoma are benign. This is a summary table showing how to differentiate between different adenomas. I hope you like this session and you can approach a case of adenoma of breast with confidence. If you have learned something and think the session is useful, I request you to kindly like, share and subscribe. If you want any other topic, please let me know in the comment box. Thank you.